Hello viewers and welcome to MedGate Today TV Digital. Today we are at 7th edition of Thought Leadership Summit, an initiative by HOSMAC. And we have with us Mr. Shashank Moddhia, who had the discussion on a very dynamic topic, outsourcing clinical services, weighing benefits. So we will be getting to know the crux of what the brilliant minds had the discussion on over the podium. So let's get back to it. Hello, sir, and thank you for coming here. Could you please introduce yourself to our audience?
Sure. I'm Shashank Moddhia. I'm based out of Mumbai and I have a company called the Renal Project. I'm basically an engineer. I have a master's in biomedical engineering and I was for 10 years abroad. So I have a multinational work experience in healthcare, specifically in dialysis management. So I decided to come back to India and have this dialysis chain, which can essentially provide dialysis to the tier 3 and tier 4 and let the healthcare reach the patients rather than patients coming in to the hospitals.
Yeah. So, sir, the kind of topic in which you were a part of was very dynamic and not many people talk about it on the podium. So what were the key, you can say, takeaways which you had with the other panels?
Right. So it's a very relevant topic of outsourcing. Hospitals, now the models are changing. It was back in the days before 3-4 decades that hospital would have all the departments within themselves and they manage them. But in order to progress faster and be very much expert in your own field and towards better patient outcomes, it is very essential that you partner with people who specialize in that specific field, like for example, radiology or nephrology or ICU services. And we've seen a model in which a hospital kind of decides based on the location, based on the management preferences, which departments to outsource and which to keep for themselves. So it's a very important discussion. When we were discussing with other brilliant minds, we were just weighing the benefits that which considerations are the ones which hospitals need to keep in mind before they outsource something or kind of keep, with themselves. So we discussed that, any core competency that the hospital needs to project in order to build a brand, they want to keep it with themselves. Whereas other areas in which they do not necessarily have the amount of expertise can be outsourced. For example, nephrology, it's a super specialty, it's a very specific skill set, if you will. And if this is outsourced, it can definitely help you give more patient outcomes, better patient outcome. And our expertise and excellence can bring a lot of business to them and help them in their brand value. So these were the kind of very healthy discussions we had on the panel.
Okay. So if I talk about the percentage of the hospitals outsource the specialities like you talked about, so how much is the percentage right now? I'll not just talk about the tier 1 city, but I would like to know about tier 2, tier 3 cities as well, because all the hospitals which are in different regions have their different strategy to work on.
Right. It's very difficult to put a percentage number to it. There are a lot of categories to it. Some of them have tried. Some of them want to try. They haven't yet tried outsourcing it. Sometimes they don't even know whether there is a company I can outsource it. So that awareness piece needs to be out there. We are just a startup and we've started 5 years back. So we still have not penetrated the minds of the hospitals in tier 3 and tier 4. So that potential market is yet to open. But it can be as much as 35% of hospitals can outsource nephrology specifically, whereas it could be 80% of the hospitals who outsource some or the other department or some other services to somewhere else.
Yeah. So as you just mentioned that there needs to be an awareness. So I think the summits like this or any other summits which bring such kind of topics in the public area has to be done more. So if I ask you how you are finding this summit, how you want to, you can say, give the rate to the theme which they are having, emerging healthcare models, India and beyond.
Yes, absolutely. As I said, this is a very relevant topics to be discussed, and such kind of forums and thought leadership summits always help bring in new ideas and a different perspective how business can be run,
Yeah.
right? And it is very, very essential because there is risk involved, there is patient outcomes involved, there is finances involved, and I really, appreciate MedGate and HOSMAC and the sponsors coming together to create this kind of a forum and a platform that we can discuss and bring good ideas.
Yeah. Thank you so much, sir, for giving your insights and talking about outsourcing the resources from other, you can say, departments and bring the best for the patient and bring the patient care on the apex in healthcare. Thank you so much.
Thank you.